In Latvia, we offer our patients diagnostics and a wide range of medical services. Fully equipped hotel-type wards are available for postoperative rehabilitation. Professional doctors and staff offer high-quality medical care and humane treatment to every patient. We perform various joint replacement surgeries. Two of the most requested are hip and knee joint replacement. Initially, the doctor performs a joint X-ray examination and, if necessary, magnetic resonance imaging as well. Based on the results of the examinations, the specialist will assess the joint situation. Surgery is performed only in cases where it is necessary, and other methods to preserve the joint are not possible. Nowadays, each joint replacement surgery is performed twice. First virtually on a computer using a special OrthoView program, and then, in reality, replacing the damaged joint in the operating room for the patient. The real operation takes up to 2 hours. Most patients stay in the hospital for 4 days after the procedure. Medical staff will monitor your blood pressure, pulse, alertness, pain or comfort level, and your need for medications. Rehabilitation starts on the next day after surgery. Many patients who undergo hip replacement surgery advance to using a cane, walker, or crutches for walking within the initial days after the operation. Over the following days, the distance and frequency of walking will gradually increase. Complete recovery typically takes 2 to 8 weeks, varying based on the patient's overall health and other recovery factors. The focus is on satisfying the needs of the patient, finding the best solutions for each individual case. Schedule a consultation and regain your health.